We are aware that ActiveCare can really decrease bleeding complications just because the patients doesn't need or require to have any more of those blood thinner shots or the medications, the pills that they take, which, really increases the chances of bleeding. But with the ActiveCare, it just compresses and goes on with the blood flow, with the action of the arteries and veins. And so the cases I see, it's really a lot. Per day, it's like we have 50-60 cases per day, and most of them have the total knee and total hip replacement. Most are orthopedic surgeries as compared to the others with general surgery. So the major benefits I see for the ActiveCare treatment, first and foremost, as I've said earlier, it is very user-friendly for the patients. It's important for them to be walking around, doing stuff, even though they have that compression device on their legs. It won't hamper their daily living. The ActiveCare can be a standalone. So I can see that it's a very big help. The device is portable, it's not too heavy, and what else? Like I've said, it can prevent them from having any further complications of bleeding from what they get from that blood thinner medications, from the injectables and pills. Because with the injectables and pills, they are required, especially with the pills, they are required to have blood exams every a couple of months. And that's very uncomfortable and stressful for the patient. But with the ActiveCare, at least it's lessened, or at least they don't have to have those regular blood check workups. With the ActiveCare, it's much easier. In fact, my job would be much easier because I can explain to them what the ActiveCare is. Because with the blood thinners and the other medications, you tell them that there's a complication of bleeding and that you'll see them, the bruising. Most of all, you'd see them bruise very easily. They don't get that with the ActiveCare. I can see most of the patients in the recovery room that they really sleep comfortably. They will ask first and foremost when they come out of the surgery that what's on their legs. They can feel the compression. And then you'll tell them that they have this compression machine, which is the ActiveCare. And they feel much comfortable. The pain, as I've said, they won't complain of too much pain, especially on their operative site. It's not as often as the ones that don't have the ActiveCare machine. I think compliance would be real good as long as you get to explain, as long as the nurse gets to explain thoroughly what the ActiveCare device is. If they will know that the ActiveCare will help reduce the amount of swelling and pain, if they will know that the ActiveCare will prevent them from having any, bleeding complications, just because it will keep them from having any other medications combined with the ActiveCare. So it reduces their chances or complications of having any bleeding and fast recovery. So compliance will be much better if they understand all of those. Definitely, I would recommend ActiveCare device for the patients, to use the ActiveCare device, just because, like I said, if they go home, some of my patients, if they go home directly from surgery to recovery room to home, so it'll be much beneficial for them to have that portable ActiveCare with them and have that maximum benefit. They can ride in the car. They'll have the maximum benefit of having compressions. They're inside the house doing stuff or resting. They'll have continuous benefit for the compressions. It's very stressful to have your blood work done every now and then. So I think the very good benefit of ActiveCare is that you'll have that reduced, or at least you don't have to have those blood works checked. And at the same time, you don't get to have those complications of bleeding. You don't get to have all those bruising and stuff. I have some patients, like, they don't want any of those shots. Everybody's afraid of the needle, especially, if they're the ones giving it. And some of the patients who already experienced it doesn't want it anymore just because of the bruising they get. They said it's really painful, so they'd rather get the compression machine, which is the ActiveCare. most of the patients also, if they come back again for surgery and they have been in active care before, they would really say that they like the product and it's user friendly.